After a standard hip replacement, it's typical for patients to be in hospital for about 3 to 4 days. Usually, the day after the surgery, a patient will be able to stand up and transfer from the bed and sit in the chair and start to take a few steps. By the second or third day after the operation, most patients will be able to mobilise and walk using some sort of aid, for example, sticks, crutches or a Zimmer frame. And after 3 to 4 days, patients will be able to climb stairs, descend stairs, and hopefully will be ready for discharge back to home. With anterior approach hip replacement, what we tend to see is an accelerated process. It's quite typical for patients to be mobilising the day after surgery and walking with perhaps 1 or 2 sticks. I have had patients recently who've been able to stand and walk the day after surgery without any aids at all. Patients can be discharged back to their home, sometimes within 2 or 3 days. And also, we've seen a significant reduction in the requirement for painkillers after anterior approach hip replacement when compared to standard hip replacement techniques. Once you're at home after your hip replacement, standard hip replacement patients are usually advised about certain precautions. To try and reduce the risk of their hip replacement dislocating, it's typical to require aids, for example, a seat raise on the toilet, and they are given advice about avoiding low chairs. Also, it's not advisable to cross your legs after a hip replacement. With anterior approach hip replacement, because we feel the risk of dislocation is reduced, we're more relaxed about these sort of precautions. But it's still sensible to be careful with your new hip replacement once you're discharged home.